Welcome to the deep dive. We talk a lot about AI, how it's changing healthcare diagnosis, treatments, but today we're looking at something maybe a bit unexpected, AI actually teaching future doctors.
Yeah, it's a fascinating development, isn't it? Moving AI right into the classroom.
Exactly. So our mission today is a deep dive into this study. It's from the International Journal of Medical Informatics. It looks at Watson for Oncology, that's an IBM AI, and how it's being used with medical students. We want to unpack what this research means, for learning complex stuff like medicine. And for you listening, hopefully you'll get some quick insights, maybe some aha moments about how tech is shifting even how we learn fundamentals.
Sounds good. It's definitely a shift worth exploring.
Okay, so let's unpack this a bit.
Yeah.
Before we get to the AI, maybe set the scene. Medical education today often uses case-based learning, CBL. It's pretty standard, right? Gets students looking at real-world type scenarios.
Absolutely. CBL is huge. It's very learner-centered, meant to boost clinical skills, teamwork, problem solving, that sort of thing. It's generally seen as quite effective.
But there's a challenge there, isn't there? Especially in fields like oncology that moves so incredibly fast.
Oh, definitely. That's the core problem. Traditional methods, textbooks, lectures, they struggle. Clinical oncology, for example, it's just relentless. New treatments, new guidelines, constantly updating.
Like trying to hit a moving target with a static textbook.
Pretty much, yeah. It's tough for the curriculum and even for instructors to always have the absolute latest information integrated. It's a real bottleneck.
So students might be learning stuff that's already slightly out of date.
It's a risk, certainly.
Yeah.
They might not be exposed to the very latest protocols, which, could potentially impact care down the line. And it just means more catching up they have to do on their own once they graduate.
Okay, so that's the gap. Is this where something like Watson for Oncology comes in? What is WFO exactly?
Right. So WFO Watson for Oncology, it's an AI system from IBM. Think of it as a cognitive clinical assistant. What makes it powerful is, well, first, it's absorbed masses of information. The latest international guidelines for major cancers like NCCN, ESMO.
Those are the big ones, the standards everyone follows.
Exactly, the gold standards globally. Plus, and this is crucial, it's had clinical practice training at Memorial Sloan Kettering Cancer Center, MSKCC.
Wow. Okay, so it's not just book smarts, it's seen real-world application. Sort of.
Precisely. It combines that huge, constantly updated knowledge base with practical training from a top institution. That's why it's considered, probably the most mature AI decision support system in oncology right now. Keeps learning, keeps updating from new research publications.
Okay, that sounds impressive on paper, but has it actually been tested in, real clinical settings? Does it hold up?
Oh yeah, absolutely. It's not just theory. WFO has been used quite a bit, particularly in China. And studies there have shown really high agreement concordance, they call it, between WFO's recommendations and what actual human multidisciplinary teams decide for lung cancer, liver, breast, ovarian.
So it's accurate in practice.
Very accurate, yes.
Yeah.
The evidence shows it's reliable.
Right, here's where it gets really interesting then. If it's that good in the clinic, could it actually teach? Was that the idea behind the study?
That was exactly the goal, to see if they could build a new way of teaching using WFO with undergraduate medical students, and then, measure how well it worked compared to the standard CBL model, effectiveness, student satisfaction, and the whole package.
Okay, so how did they actually run the experiment?
It was a pretty solid setup. They took 72 undergrads from Wuhan University, all studying clinical medicine, randomly split them, 36 in the WFO group, 36 in the control group. And they made sure first that the groups were balanced, age, gender, even their test scores before the class started. So a level playing field.
Makes sense. And the course itself, how is it structured?
So both groups got the same initial dose of theory in a traditional class, standard stuff. Then they moved into the clinical CBL classes, supervised by experienced oncologists.
And this is where things change depending on the group. Tell me about the WFO group. What did they do?
Right. So the WFO students, they'd look at a case, figure out their own treatment decisions first. Then, and this is the cool part, they'd input all the patient data into the WFO platform. WFO spits out its recommendation, and then the discussion happens. They compare their decisions to the AI's.
Oh, interesting. So they're directly comparing notes with the AI.
Exactly. They talked about why they matched, why they differed, what that meant, and they also discussed the bigger picture, the role of AI in medicine generally. It sparked a lot more debate.
And the control group. Just standard procedure.
Yeah, the control group did it the traditional way, discussed the cases, formulated decisions based on their textbooks and current guidelines. No AI involved at all, just the usual CBL process.
Okay. And then assessment. How did they measure the difference?
Two main ways. First, a final exam testing knowledge, especially the theoretical oncology stuff. Second, they used an anonymous questionnaire. This dug into the learning experience itself, things like independent learning, knowledge mastery, interest, participation, and just overall satisfaction.
All right, let's get to the results then. What did the final exams show?
Okay, this is interesting. The WFO group did score slightly higher on average, like 89.5 versus 85.9. And their excellent rate was a tiny bit higher too, 28.3% versus 25%.
Not.
But statistically speaking, there was this significant difference in the overall exam scores between the groups. However, where they did see a clear difference was specifically in the case analysis questions. The WFO group performed notably better there.
Case analysis. So not just remembering facts, but applying them to complex situations.
Exactly. That's the implication. It suggests the AI didn't just help them learn facts, it helped them learn how to use those facts in a practical clinical context. That's a really important distinction.
Yeah, that seems crucial for actually being a doctor.
Definitely.
Oh.
And then there's the questionnaire looking at the student experience. And here the differences were really striking and statistically significant.
Ah, okay. What did that show?
The WFO group scored significantly higher across several areas. Cultivating independent learning ability, big difference there.
Right.
Increasing knowledge mastery again, significantly higher for the WFO group. Enhancing learning interest, same story. Increasing course participation. Yep, higher again.
Can you give us a sense of those numbers? Were they big jumps?
Yeah, they were quite clear. For instance, independent learning was 17.67 for the WFO group versus 15.17 for control, with a p-value of 0.018. That p-value tells us it's very unlikely to be chance. Knowledge mastery. 17.75 versus 16.25, p 0.001, learning interest. 18.41 versus 17.00, p equals 0.00, participation. 18.33 versus 15.75, p 0.001. It really seems that way. That interactive process, comparing their thoughts with the AI, seems to have made them much more active learners. Less passive reception, more active investigation.
Was there anything where the groups didn't differ significantly?
Yes, one area. Improving ability of expression. So their communication skills seem to develop at about the same rate in both groups. The AI didn't specifically boost that aspect.
Okay. But overall satisfaction, how did the students feel about the course itself?
Hugely positive for the WFO group. Their overall course satisfaction score was 89.25 compared to 80.75 for the control group. Again, highly statistically significant. They clearly preferred the AI-augmented approach.
So what does this all mean then, stepping back? We see better engagement, better application skills.
Wow.
What are the bigger takeaways?
Well, on a practical level, it shows this WFO-based method really does give students a richer learning experience. And it gives them a new kind of tool they might actually use later in practice. It turns the classroom into more of an AI-supported learning space. It boosts self-learning, mastery, interest, participation, all good things.
And what about for the teachers? Does this change their role?
That's a really interesting point. The study suggests yes, because WFO can provide all that up-to-date evidence-based information quickly. It potentially frees up the instructor's time and energy.
Frees them up. How? To do what?
To focus less on just delivering factual content and more on the pedagogy, the how of teaching, engaging students more deeply, facilitating discussions, maybe spending more time on the crucial ethical considerations around AI in medicine.
Ah, the ethical side. And perhaps the human side too, like empathy?
Exactly. That's maybe the most crucial point. The study highlights, maybe implicitly, that there are inevitable gaps AI can't fill, and the human teacher's role becomes absolutely vital in cultivating things like empathy, humanistic care, communication. The skills AI can't replicate.
So it's not about replacing teachers, but maybe shifting their focus to uniquely human skills.
Precisely. AI handles the data crunching, the guideline updates. The human teacher fosters the human connection, the compassionate side of care. It encourages a more holistic approach.
Okay, that makes a lot of sense. Now, every study has limits. Did the researchers mention any for this one?
They did, yes. They acknowledged that sample size 72 students are relatively small. And they also felt their evaluation system, especially the questionnaire, could be more precise, more refined.
So what's next? Are they planning follow-up research?
Yep. They plan to expand the study, bigger sample sizes. They want to refine how they measure the outcomes, use more rigorous tools. And importantly, they want to try this WFO-based CBL approach with postgraduate students and oncology residents too, not just undergrads.
See if the benefits hold up with more experienced learners.
Exactly. That'll give a much fuller picture of its potential across different stages of training.
All right. So wrapping up this deep dive, it really feels like we've seen strong evidence that AI, like Watson for oncology, can be a genuinely valuable teaching partner in medicine. It enhances learning, boosts engagement, particularly for applying knowledge.
Yeah, it's a powerful tool, but crucially, it also throws into sharp relief how important the human element is. The human teacher's role in nurturing empathy, critical thinking beyond the data, that seems more vital than ever.
Which leaves us with a final thought for you, our listener. As AI keeps weaving its way into learning, not just in medicine, but maybe law, engineering, even creative fields, where else could this kind of AI augmented education make a difference? And maybe more importantly, what parts of teaching and learning will always need that uniquely human touch? Where is that human element truly indispensable?
Something to ponder, definitely. The intersection of human and artificial intelligence in education is only going to get more interesting.
Absolutely. We hope this deep dive has sparked your curiosity. Until next time, keep exploring.